How does Africa plan to tackle health threats in 2023? The past few years have been marked by several health emergencies, including the COVID-19 pandemic, which has posed a serious challenge not only to public health, but also to economies and livelihoods. The continent also faces health threats from other infectious diseases, from humanitarian crises, and the rising burden of chronic illnesses such as cancer and diabetes. Every year, according to the World Health Organization, Africa faces more than 100 health emergencies, more than any other region in the world. We can now welcome to the program Dr. Ahmed Ogwel Oma, the Acting Director of the African Union's Centers for Disease Control. He joins us from Addis Ababa. Thank you for joining us on the program, Dr. Oma. Now, the continent has faced major healthcare challenges recently, yet it's coped with outbreaks like COVID and Ebola better than some predicted. What do you think this says about the continent's state of preparedness for these threats?
Thank you for having me. The number of public health events that we've dealt with throughout 2022, for example, is in excess of a dozen, although the most known ones will be COVID and Ebola. We practice a very simple principle, and that is building the capacity of our member states to be able to respond to any immediate outbreak, and then providing them with the support, technical, financial, and otherwise, which they need to be able to bring that control, that particular outbreak under control. This means that with time, the continent has built very good capacity for responding to some of these outbreaks. We have built very good networks across the continent of supporting each other whenever we need to respond to a large outbreak. And we have also built very good trust with our leaders, the political leaders, with our partners, and with the private sector and the members of the public on the continent. That means that when we move as a team, and this has resulted in the good results that you see with COVID, with the rapid control of Ebola in Uganda and DRC and other places.
Right, and on that note, what lessons, for example, from these incidents, these events, are you taking forward in your role?
As we move into the new year and into a new phase for Africa CDC, there are a few things, and I'll share three, that we really need to do to ensure that we continue to have good success here on the continent for outbreak prevention and control. One is early warning systems. We know pathogens are there in the community, and we know they will circulate because it's the nature of viruses and bacteria and others to do that. What we need to do is we must know when an outbreak has occurred, and we are able to respond rapidly to keep the outbreak small. So early warning systems at country level is the key thing in health security for the continent. Second thing that we must do is to strengthen our institutions that are designed to respond to public health, whether it is national public health institutes, whether it is national CDCs, whether it is national research institutions, whether it is health facilities that are used to take care of those who are unwell. The national level institutions must be strong, because when you have those strengthened, then you have reaction time shortened. The third thing that we must be able to do to keep resilience is local production. We cannot wait for test kits to come from elsewhere for us to be able to respond rapidly. We cannot wait for vaccines to be consumed to the fullness of populations elsewhere before we start vaccinating ourselves. Local production of simple things like masks, complex things like vaccines, we must do it here on the continent. And all these are embodied in what we call the new public health order, right, which we as Africa CDC are coordinating and leading its implementation here on the continent of Africa.
And you talk about these achievements, these successes. There have also been African scientists, for example, who've received some recognition for their work during the COVID pandemic. But do you think the rest of the world is listening and learning from these frontline experiences in Africa?
They are. is my simple answer, because today we have been sharing our experiences very robustly across the continent in every platform that we are invited to share. And the world is also seeing the results of what we do, and they are asking. And there are many countries that have come to ask, how did we do this and how did we do the other? But apart from being asked, what we have decided to do is to ensure that all our experiences have been well captured in our strategies and our engagement with other institutions. That way, someone doesn't have to ask. We'll be sharing on a very regular basis, and I am very confident that going forward, Africa is going to be a leader in health security. We are not going to be the ones who wait at the end of the queue anymore.
Great. Dr. Ahmed Ogwell Omar, Acting Director of the Africa CDC. Thank you very much for speaking to us.
Thank you for having me.